Hi everyone, my name is Dr. Frankie Jackson-Spence and I'm the Health Expert Ambassador for FemFresh. This month's video for our Women's Health Wednesdays is a very requested one and it is going to cover Polycystic Ovarian Syndrome. Now, Polycystic Ovarian Syndrome, also known more commonly as PCOS, is a condition that affects the ovaries and it can affect up to 1 in 10 women, which is probably more than people realised. Despite being fairly common, there are lots of myths and misconceptions surrounding PCOS. So in this video, I'm going to delve into them, talk about what it is, and talk about some of the symptoms and treatment. So stay tuned. Now, the first confusing thing about PCOS is the name. So Polycystic Ovarian Syndrome, you would assume that that means that you have cysts on your ovaries. Now, for 2 reasons, this is incorrect. The first is that you don't actually have to have cysts on your ovaries to be diagnosed with this condition, and the second is that they're not really cysts, but let's get into that in a moment. How do you know if you have PCOS? Well, PCOS is usually diagnosed in the late teens, early 20s, and around half of women who have this condition don't actually show any symptoms, which can make it difficult to diagnose. Symptoms vary from woman to woman, but can include things like irregular periods, which is probably the most noticeable symptom. Some women may even not have any periods at all. Some women may notice some excess hair growth, particularly in the kind of male hair growth pattern, so on the face, chest, back, also known as hirsutism. A troublesome symptom that many women really don't like is that PCOS can often mean that you can struggle to lose weight or may even gain weight, may experience more acne and spots, and also some women may experience difficulties in getting pregnant. Now, that's not to say that if you have PCOS you can't get pregnant or you're infertile, and that's a massive myth that scares many women and is a big cause of anxiety. It might mean that it's a little bit more difficult to get pregnant or takes a little bit longer, and that's something to speak to your own doctor about. But most women with PCOS do go on to have successful pregnancies if they so wish. So how is it diagnosed? Well, many women might actually have some of the symptoms I've just mentioned without actually having a diagnosis of PCOS. To be diagnosed with PCOS, you need to have 2 out of 3 of the following criteria. Number 1 is this polycystic ovaries. So let's delve into that a little bit. Each month during ovulation, an egg is released from the ovaries, and these eggs develop in something called follicles, which are fluid-filled sacs. And each month, usually 1 or 2 follicles will develop, and then 1 or 2 eggs will be released. Now, in polycystic ovarian syndrome, more of these follicles start to develop, but they are immature and not properly developed. So you can get lots of these fluid-filled sacs, these follicles, but sometimes no egg is even released. And that is where the term cystic comes from. So on an ultrasound scan, which is a jelly scan where we can have a look at the ovaries, it will look cystic, meaning we can see lots of these immature follicles on the ovaries, and that has been given the term polycystic ovaries, but they are not truly cysts. The second criteria is a regular period. So due to these immature follicles I've just mentioned, there may not necessarily be an egg released each month at the time of ovulation, and this can affect hormones and the regularity of a menstrual cycle. So some women may get irregular periods or no periods at all. And the third criteria is excess androgens. So androgens are the male hormones, things like testosterone, and often in PCOS, women have a higher level of these male hormones, androgens, and that results in some of the symptoms I mentioned, such as excess hair growth on the face and acne and things. It is normal for women to have some male hormones like testosterone, but in PCOS, these are often at slightly higher levels. So you only need 2 out of 3 of these features to be diagnosed with PCOS, meaning you don't actually have to have the polycystic ovary criteria. You could just have the excess androgens and the irregular periods and still have a diagnosis of PCOS, which is confusing for many people. Also, on that note, if you only have 1 of these criteria and you have polycystic ovaries on a ultrasound scan, that doesn't mean you have polycystic ovarian syndrome, because it only means you have 1 out of the 3 criteria. Confusing, right? So what causes PCOS? Well, the exact cause of PCOS is unknown, which can be highly frustrating for women who experience the symptoms. It does often run in families, and it is thought to be related to abnormal levels of androgens, the male hormones, and also a change in the sensitivity to a hormone called insulin, which is responsible for our blood sugar levels and metabolism. Many women with PCOS are slightly more resistant to the hormone insulin, meaning their body produces more insulin to compensate for that. And insulin in turn can contribute to the production of male hormones such as androgens. which is how this is all connected. But we won't get into the complicated physiology. So what should you do if you think you are affected by PCOS? If you think you are affected by any of these symptoms that I've mentioned in the video, then please go and get some advice from your own doctor. If in doubt, it is always better to get checked out as opposed to making a self-diagnosis. Diagnosis usually starts with a simple blood test, and then you may require an ultrasound scan if they do suspect that you may have it. And there are treatments available from PCOS, and these range from tablets you can take to things like weight management. So it's definitely worth speaking to your doctor about. Did you know about all these features of PCOS? If you have any questions or comments about this condition, then please feel free to leave us a comment below. I'm Dr. Frankie, and this video is in collaboration with FemFresh. Thank you for watching, and I will see you in the next video. Bye now.